Well, I'm P Yadava. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. Well, definitely, if the heart is damaged, then the results of the bypass surgery are not going to be as good, because bypass surgery does not undo the permanent damage of a previous myocardial infarction. So whatever area of the myocardium is stunned and hibernating, that would certainly recover after a bypass surgery, but whatever area of the heart is necrosed and fibrosed will not recover. So long-term results definitely cannot be as good in a patient with LV dysfunction who would definitely have some area of the myocardium permanently damaged. Also, we find that the immediate results of patients with LV dysfunction are slightly inferior to the patients with normal ventricular function. We have problems and issues of hemodynamic stability during surgery, and we may need artificial heart support systems like intra-aortic balloon pump for these patients. We also find that these patients may be prone to more arrhythmias because of the interference of a viable myocardial muscle along with a fibrosed tissue. Also, these patients generally have borderline hemodynamics, and therefore subsystem function also is impaired. So renal problem, renal shutdown, pulmonary problems is slightly more in these patients. A dilated heart may also produce exposure problem, and sometimes one may even have to resort to use of the heart-lung machine in these patients.